Peripheral neuropathy can cause significant pain and discomfort in your feet, often stemming from conditions like diabetes, where high blood sugar levels damage nerves over time, vitamin B12 deficiency affecting the myelin sheath, infections such as Lyme disease or HIV, autoimmune diseases, alcohol abuse, certain medications like chemotherapy drugs, or the natural aging process. This condition results from damage to peripheral nerves, leading to symptoms such as numbness, tingling, and muscle weakness. It disrupts the communication between the brain and other body parts, affecting sensory, motor, and autonomic nerves. One effective method for relief is soaking your feet in warm water with Epsom salt, which can significantly ease pain and discomfort. This soothing remedy relaxes tense muscles, improves circulation, and helps alleviate irritated nerves in the feet. The magnesium sulfate in Epsom salt helps reduce inflammation and promotes healing, as a 2020 study showed that a 15-minute soak at 100 degrees Fahrenheit significantly reduced pain from diabetic neuropathy. The warm water draws out toxins, reduces swelling, and enhances overall foot comfort. Alpha-lipoic acid, or ALA, is an antioxidant supplement that can improve nerve conduction velocity and alleviate neuropathic symptoms like pain, numbness, tingling, and burning sensations. Regular supplementation supports nerve health effectively. Clinical trials have demonstrated that 600 milligrams of ALA daily can improve neuropathic deficits by helping to maintain the structural integrity of the myelin sheath, which is essential for efficient nerve conduction and signal transmission. Gentle foot massage and reflexology can improve circulation, reduce inflammation, and release tight muscles in the feet. These hands-on techniques provide immediate relief and can be easily performed at home on a daily basis for ongoing benefits. Reflexology, by applying pressure to specific points on the feet, such as the arch or heel, may modulate nerve signaling and enhance blood flow, offering further relief. These points correspond to different parts of the body, promoting overall wellness. Vitamin B12 is crucial for maintaining a healthy nervous system, promoting myelination, increasing nerve regeneration, and decreasing ectopic nerve firing that contributes to pain. It plays a vital role in nerve protection and repair. A deficiency in B12 can lead to nerve damage, causing symptoms like numbness and tingling, so incorporating dietary sources is vital. Rich sources include red meat with marbled fat, poultry, fish fillets, dairy products, and eggs, all fresh and nutrient-packed. Capsaicin cream, derived from chili peppers, can relieve neuropathic pain by stopping nerves from sending pain messages to the brain through depleting substance P, a key pain-signaling neurotransmitter. It is available as a cream or patch for easy application. While initial application may cause a temporary burning sensation as the skin adjusts, regular use, such as twice daily, can significantly reduce chronic pain over time. The desensitization effect provides lasting relief for many users. Toe exercises are excellent for nerve stimulation, improving blood circulation and strengthening foot muscles. For toe curls, place a small towel under your feet and use your toes to grab and release it, holding each grip for 5 seconds and repeating 10 times on each foot. Examples include toe curls, ankle rotations, and foot flexes, each designed to enhance foot health and mobility. Ankle rotations involve sitting comfortably and moving your foot slowly in circles, 10 times in each direction to boost flexibility. For instance, in foot flexes, point your toes away from you, then pull them back toward your legs, holding each position for 5 seconds and repeating 15 times. This exercise effectively targets the foot muscles and stimulates nerves. Managing underlying causes, such as controlling blood sugar levels for diabetic neuropathy and addressing vitamin deficiencies, is crucial for long-term relief and preventing further nerve damage. Lifestyle modifications like regular exercise such as walking outdoors, a healthy diet with vibrant salads, and avoiding smoking and excessive alcohol can also significantly improve nerve health and circulation throughout the body. If your symptoms persist or worsen despite home remedies, consulting a neurologist or pain specialist can provide comprehensive care, advanced treatment options, diagnostic tests, and personalized medications. Describe your neuropathy symptoms in the comments below to connect with others facing similar challenges, share experiences, and discover additional tips for relief.